Right, so we're here to talk about Vaser today. Have you been thinking about this for a while?
Yeah, about 6 months.
Okay, so looking at your height and your body weight, you have quite a good BMI. Your body mass index falls nicely in the normal range, so you're not particularly overweight. So tell me, why do you want to have Vaser?
To kind of help shift the areas that I've been struggling to go with exercise and diet, a little bit of stuff fat around my stomach and love handles.
Okay, so you do work out, you exercise?
Yeah, 3 or 4 times a week at the gym.
That's fantastic. 3 times a week is maintenance. Half an hour to an hour, 3 times a week will maintain our body physique. If you do any more than that, you're actually improving it. That's the sort of general rule, if you will. So 3 to 4 times a week is fantastic. If I just tell you a little bit about Vaser, I'm not going to get too technical, but essentially Vaser Liposuction is an ultrasound form of liposculpture where we use sound waves to break the fat apart. Now, when I say break it apart, it acts on the forces between the fat cells, not on the fat cells membranes themselves. So those fat cells actually survive. It's that gentle and that selective when it comes down to it. And essentially what that would mean to you is, as the patient, you can be rest assured, if you will, that when we're taking the fat out, we're doing the least amount of trauma to you that we can. Alright, so it's less downtime, less bruising, less pain, less mobility issues, things like that afterwards. At MYA we do the procedure under a local anesthetic. We have an anaesthetist who will administer a conscious or twilight sedation, which means that you will be awake enough to respond to me. If I say, Tom, please turn over, you'll turn over. However, after the operation, you won't remember actually turning over. So the anaesthetist is there to manage anxiety levels and just keep everything nice and calm, and the memory of it won't be there afterwards. We limit the procedure time to about 2 hours at the most. So your procedure can take anything from half an hour all the way through to 2 hours, depending on how much we have to do or you would like us to do, what level of results we're looking for. The way we work out how much we can and how much we need to take, firstly, in this consultation we'll have a look and we will judge from what you would like as a result as to how much needs to be taken to achieve that result. But at the same time, we must be aware that the numbing agent, so the local anesthetic agent that we use, which is called lidocaine, we use a certain amount of it per kilogram of your body weight. And that determines how much we can use in your body at one time safely. Once we have that number, we then, because we understand how much we need to put into the tumescent fluid, so that's the fluid that we use to numb up the area but also to expand the fat volume. Once we understand how much we've got to use, we can then calculate, so we have a litre or 2 litres or even 3 litres of local anesthetic tumescent solution that we can infuse into your body before we actually start the operation. And that coincides nicely with, if we put 3 litres in, then we can take 3 litres out.
Okay.
In a clinic setting, we wouldn't really want to take more than that, because we want to make sure that you're fine to go home on the same day. The anaesthetist will stop the sedation at the end of the procedure, and you will be moved and you will walk to a quieter room where you can relax and recover, have something to eat, something warm to drink, and we can make sure that you're fine. Now, it may take an hour, it may take a couple of hours before you're ready to go home, generally we ask that you bring somebody, or somebody comes to escort you home, spends that first evening with you, just to make sure that everything's fine. So, if we go back to you, which are the areas that really you're finding difficult to shift in the gym?
Mainly the lower back and my abdomen, my stomach.
Okay. So these are areas that a man might find difficult to shift. We genetically are programmed, if you will, to store fat in some areas. Some women may find that the lower half of their body is where they pick up weight first and lose weight last. And those are the sort of stubborn areas that we particularly find with men. You work out enough, you've got good muscle underneath, and so removing that fat, because of the technology that we use, the Vaser technology, even with men, it's become quite a simple procedure. You have a good shape, and we want to keep that good shape. So back in the day, when we did conventional liposuction, we would just go in and try and make everything smaller. Nowadays, it's very much about maintaining a good shape along with making you smaller. So you may lose a size or 2 sizes post-operatively, but we want to make sure that the shape that you have is retained. So when we operate on a lower tummy and an upper tummy, and generally we will do those 2 areas together to achieve the best result, and the flank area, or as you call the love handle area, we would start with you on your tummy and take that fat from around the back first, and then we would turn you over and we would do the upper and lower tummy areas. Once we've removed the fat, we will put you in a garment, okay, and the garment can be quite snug. If you're having the sort of core area, so tummy or back areas done, there may be a foam insert, almost like a vest that goes underneath your garment, and that's just to make sure that the compression is evenly distributed over your skin. It also protects your skin from everything on the outside, so tight waistbands, belts, things like that, that people don't really know but shouldn't be worn after an operation like this for at least a month, just to make sure that the skin is smooth and there's no pressure on it that's undue. Alright.
Would you be able to see that garment under normal clothes?
It might make you feel and look a little bit bulky, depending on the clothing that you might wear. It is probably the most uncomfortable part of the recovery, is to wear this garment, but it's really, really necessary. If you don't wear the garment, your body's natural reaction would be to fill the spaces that we've removed fat from with fluid, and you would then collect what we call seromas, so little pockets of fluid. Now, if those are managed early and correctly, then it's not a problem at all. But if it wasn't managed properly, then those could lead to further complications. So in order to avoid those, in order to help with the retraction of the skin and the smoothness of the contour, the garment is very, very important. It needs to be worn for a month. However, the foam insert, if your doctor agrees, can be worn for 2 weeks, day and night. And beyond that, probably just in the later part of the day and overnight.
Okay.
Another thing to remember is that you will need a little time to recover, so it's best that you take a little time off from work. I'm not saying weeks and weeks and weeks, a few days should be more than adequate, depending on the size of the operation that you have. Exercise. I know that you exercise 3 to 4 times a week, and some people are quite inquisitive about when they'd be able to go back to exercising. There's nothing stopping you from exercising after 2 weeks, sometimes 3 weeks. What we want to make sure is that the body is healed enough for you to be able to progress and go back into the gym and do some exercise. It's not a good idea to go straight back in as hard as you can. It's a much better idea to just gently put yourself back into the situation of exercising, and remember the rule that if it hurts, it's too early, don't do it. Okay?
Okay.